Hey everyone, welcome once again to Coverage Confessions. My name is Maria Angel Martinez, and this is your go-to show for unraveling the most confusing parts of Medicare. Straight talk, real stories, and expert guidance all together into one place where we break it all down with stories that could easily happen to you and lessons that nobody else probably takes the time to explain. Here, you'll get real answers, avoid costly mistakes, and make smarter decisions about your health coverage. So let's dive right in. Today's confession comes from Tony, a veteran who wrote to us saying, I am about to turn 65 and I currently receive health care through the VA. My friends are talking about enrolling in Medicare, but I am completely confused. Do I even need Medicare? How does Medicare work alongside my VA benefits? And what about TRICARE? Or even CHAMPVA. Honestly, it's completely overwhelming. Tony, thank you so much, not only for your question, but most importantly for your service. And let me tell you, you're definitely not the only veteran feeling this way. It is confusing. So today, we're gonna talk directly to all the Tonys out there. We're gonna break down VA benefits, and TRICARE and CHAMPVA and how all these coordinate with Medicare clearly, carefully, and with zero fluff. So let's start with VA healthcare, which is Tony's situation. If you're a veteran and you qualify for VA benefits, you may already be getting care at VA hospitals or clinics. So that care often includes checkups, hospital services, prescriptions, and sometimes specialty care related to service-connected conditions. And best of all, for many veterans, it's either free or very low cost. But here's the catch. VA coverage only works inside the VA system. So if you go to a regular hospital or try to see a civilian doctor outside the VA, you're not covered, unless it's a VA authorized facility or you've gotten prior approval. And there's where Medicare comes in. Medicare gives you access to providers outside of the VA. If you enroll in Medicare Parts A and B, you can actually go to civilian hospitals, clinics, and see specialists that aren't affiliated with the VA. So you get that flexibility. And no, the VA and Medicare don't necessarily talk to each other. They don't bill each other and they don't coordinate. You either use one system or you use the other, depending where you go. So you don't have to enroll in Medicare technically, but here is my advice. Enroll anyway. Even if you plan to use the VA most of the time, having Medicare means that you won't be stuck if you move or travel or face an emergency away from the VA facility. So technically, it protects you. Now, let's talk about TRICARE. If you are a military retiree or the spouse of one, you might already have TRICARE. It's a fantastic benefit that offers comprehensive coverage. But here is where it gets a little tricky. Once you reach 65. So if you want to keep your TRICARE benefits, you must enroll in Medicare Part B. That is not optional, it's actually a requirement. So how does it work in practice? Once you turn 65 and enroll in Medicare Parts A and B, your regular TRICARE coverage becomes TRICARE for Life. And TRICARE for Life pairs beautifully with Medicare. Medicare becomes your primary payer and TRICARE for Life becomes your secondary payer. That means that when you go to a doctor or hospital that accepts Medicare, Medicare pays its share of the bill first. Then TRICARE for Life steps in and pays the rest of the bill, usually covering your deductibles, your co-pays, and your co-insurance. It's a very strong combo. You're essentially covered for almost everything medically necessary as long as you see providers who accept Medicare. Now, let's talk about how this works outside of the United States, because here's something that a lot of people don't realize. Original Medicare does not cover you abroad. So if you travel internationally and you need care, Medicare won't help you, but TRICARE for Life does offer some overseas coverage. So TRICARE for Life also may reimburse you for certain medical expenses incurred outside of the country. And this is actually a big reason why many military retirees like the fact that they have to have them both. Now, here are a few more details that you should know. Enrollment in Medicare Part B is absolutely required if you want to maintain your TRICARE benefits at age 65 or older. So if you don't sign up, you will lose your TRICARE until you do. Now, there's no monthly premium for TRICARE for Life, but you still have to pay your Medicare Part B premium, which this year, 2025, it's $185 per month for most people. But TRICARE itself doesn't charge you anything extra, so that's all you will pay. You don't need to get a separate Medicare Advantage plan or a Medigap policy if you have TRICARE for Life, but it will give you some additional benefits, and that's why some people do it. TRICARE for Life does already act like a supplement to Medicare though. So to use TRICARE for Life, you just have to make sure that your doctor or provider accepts Medicare and it's willing to bill Medicare as a primary payer. That's the key right here. So most do, but it's always smart to ask ahead of time. Now let's talk about CHAMPVA because it's often lumped in with TRICARE as if it was the same thing, but they're very, very different programs with very different sets of rules. So CHAMPVA stands for Civilian Health and Medical Program of the Department of Veterans Affairs. Whew, that's a mouthful. But this benefit is not for the veterans themselves. It's actually for surviving spouses and children of veterans who either died as a result of a service-connected disability, were permanently and totally disabled due to a service-connected condition at the time of death, or died while rated as permanently and totally disabled from a service-connected condition. So if you are the spouse or the child of a qualifying veteran, you might be eligible for CHAMPVA. Now, how does Medicare fit into all of this? So once somebody with CHAMPVA turns 65, they're required to enroll in both Medicare Parts A and B to keep their CHAMPVA benefits active. Medicare becomes the primary payer and CHAMPVA becomes the secondary payer, similar to how TRICARE for Life works. That means that when you go to the doctor, once again, Medicare pays its portion of the bill first. CHAMPVA then pays what Medicare doesn't cover, like copays, co-insurance, and deductibles. The good news, CHAMPVA doesn't have a monthly premium, but you do have to pay your Medicare Part B premium that we talked about, $185 per month for most people, but there is no extra fee to keep CHAMPVA going. The coverage is strong. Together, Medicare and CHAMPVA offer comprehensive protection, but there are some important limitations to remember here as well. You must use providers who accept Medicare. CHAMPVA follows Medicare's lead, so if Medicare doesn't approve the service or provider, CHAMPVA won't cover it either. CHAMPVA doesn't function like traditional insurance. It won't give you a network to choose from. Instead, you rely on Medicare's acceptance and payment structure. CHAMPVA also includes prescription drug coverage, which we'll look into it in more detail in the next segment. So if you are a surviving spouse or dependent and you're about to turn 65, or maybe you're caring for someone who is, be sure to plan ahead, because if you don't enroll in Medicare when you're supposed to, your CHAMPVA benefits can be suspended until you enroll into Medicare, and reinstating them after that gap can be a total hassle, honestly. So the bottom line, CHAMPVA works hand in hand with Medicare, but you need to stay on top of enrollment deadlines. Choose Medicare accepting providers and also keep both Parts A and B active. Prescription drugs are a big question for veterans, and it's something that can get really confusing very quickly because each type of coverage, whether VA, TRICARE, CHAMPVA, and Medicare, they all handle prescriptions differently. So let's break it down by group and talk about how these coordinate or don't with Medicare. If you use VA healthcare, your prescriptions are usually filled at VA pharmacies, and most veterans receive their medications either free or at a very low cost. So VA drug coverage is extremely generous, and for those who are eligible, it works wonderfully. However, VA coverage only works within the VA system. That means that if you go to a local non-VA pharmacy, even for something urgent, you're responsible for 100% of the cost unless the VA has specifically authorized that fill. VA and Medicare do not coordinate. Medicare won't pay the difference and the VA won't reimburse you. So if you want to have access to local pharmacies for convenience or traveling or emergencies, you might want to consider adding Medicare Part D or a Medicare Advantage with prescription drugs. But, and this is important to you, you do not need to enroll in Medicare Part D if you're happy using VA pharmacies and you don't mind that restriction of sticking to those. If you have TRICARE before turning 65, it includes prescription drug coverage through the TRICARE Pharmacy Program, which offers access to military pharmacies, mail order through Express Scripts as well. Most prescriptions come with very low copays or even no cost at all. Now, once you turn 65 and you enroll in Medicare Parts A and B, and your coverage becomes TRICARE for life, the good news at this moment is that your prescription drug coverage continues under TRICARE. Medicare doesn't cover prescription drugs under Part A and B only, so like original Medicare. So TRICARE becomes your primary source of drug coverage. What that means for you is that you do not need Medicare Part D. You can enroll in an Advantage plan that has no prescription drug coverage. That's perfectly fine, but it's best that it's one that they call them MA only, so Medicare Advantage only, that does not have prescription drug coverage. Your prescriptions with TRICARE for Life are still covered through Express Scripts mail order and military pharmacies as well. Most medications have very affordable copays for you. For example, $5 to $15 for a 90-day supply, depending on the medication tier or level. So Medicare Part D plans and TRICARE are not gonna coordinate, and enrolling in both can actually lead to confusion or even disruptions in coverage. Unless you have a very specific reason, like I said, it's best to stick with TRICARE's prescription program if you're eligible for it, of course. Now, if you have CHAMPVA, you also get drug coverage through the program. CHAMPVA offers its own mail order pharmacy service called Meds by Mail, which is available for maintenance medications, and it also allows you to use retail pharmacies in the Optum Rx network. As with TRICARE, CHAMPVA provides enough coverage that most people don't need a separate Medicare Part D plan or Advantage plan with prescription drugs included. Now, what happens if you enroll in a Medicare Advantage plan that does have Part D built in it? This is where things get tricky. If you're using VA healthcare and you enroll in a Medicare Advantage with prescription drug coverage, the two won't conflict, but they won't coordinate either. So your VA meds will still come through the VA pharmacy, and your Advantage plan meds will go through their specific pharmacy network. You can use both, but they operate completely separately. If you have TRICARE or CHAMPVA, adding a Part D plan or a Medicare Advantage plan with drug coverage could interfere with your military benefits. In fact, it might actually disqualify you from parts of your existing drug coverage, or even complicate how your bills are paid. That's why it's generally best not to enroll in a separate drug plan or a Medicare Advantage with drug coverage if you already have TRICARE for Life or CHAMPVA. Your existing benefits are going to be more than sufficient. So bottom line, most veterans don't need Medicare Part D. The coverage they get through VA, TRICARE, or CHAMPVA is usually excellent. But if you want more flexibility or your current setup doesn't meet your needs, let's talk to someone who understands both sides, the military and also Medicare, before making any changes. So before we wrap up here, let me tell you my top 5 tips for veterans who are approaching Medicare age. Know your coverage, the coverage that you already have. Is it VA? Is it CHAMPVA? Is it TRICARE for Life? How are they different? How do the rules work? Let's talk about it. Let's get it figured out before you do anything else. Also, enroll in Medicare Part B on time. If you have TRICARE or CHAMPVA, it is mandatory. Please don't forget and don't miss the window. Another one, you can have both Medicare and your veteran benefits. Use each one when it makes the most sense. Don't automatically buy a Part D plan. Your current coverage might already give you everything that you need. Here's one more. Ask for help. Whether it's a Medicare agent or a veteran service officer, just don't guess. Please ask. Getting this right could be the difference between having full coverage or dealing with gaps and unexpected costs. And this wraps up today's episode of Coverage Confessions. Tony's question is one that I hear very often, and I hope that this gave you and all the veterans some much needed clarity. And remember, your experience with Medicare truly matters, and your story could actually help someone else. So if you have a confession to share with me or a question that you've been holding on to, please drop it in the comments, message me directly. I'd love to hear it. Or if you want to reach us, you can do so. You can find us on Facebook. You can find us on Instagram at Northstar Insurance. Please send us an email, call us. However is your preference, please just do so. And if this episode helped you, please don't forget to like it, subscribe to our channel, or even share it with someone else who might need to hear this information. As for me, I'll see you in the next episode, and I really hope that the next chapter of your Medicare journey is one that makes you feel confident, informed, and proud of the decisions that you have made. I'll talk to you soon.